Thank you for joining us for this Medicare 101 or Medicare Basics video. In just a few minutes, you're going to learn the foundations of Medicare for 2024. And so all of the information that you're about to learn is up to date, it's current, and it's applicable for the year 2024. Well, I'm not going to waste any time because I promised in this video to get right to it. So we're going to go through a Medicare basics video. I'm going to talk to you just for about 1 minute about Medicare Pro and our company, and then we're going to dive into the rest. So without wasting any time, here we go. At Medicare Pro, we're very passionate about educating people on Medicare. So here's a little bit about who we are. We're an award-winning, licensed, certified, rigorously trained, independently owned insurance brokerage specializing in Medicare. We're actually faith-based and family-owned, and we're very passionate of not only just serving our community and helping people understand their insurance options, but we're actually passionate about being honest and friendly and down to earth and always helpful. So it's always great to have someone in your corner that you trust. And here's who we're not. We're not salesy, pushy, or dishonest. We're not here to twist anybody's arm or to use pressure tactics and things like that. We're not those people calling you and blowing your phone up on the 1-800 at like a 1-800 telesales agency. And best of all, we're not working for the insurance carrier. We work for our clients. So our motto is we make Medicare easy. And this is what we love doing. We love educating our customers, and our goals are to serve you and to help you understand all of your options so that you can get the coverage that you need. We use this 4-step process, and I like to say, let us help put you at ease, because when it comes to the confusing world of Medicare, we want to make sure that things are easy and that you can sleep at night and you're being put at ease. So this is our acronym. We like to educate, analyze, help you select, and enroll in your plan options. But everything starts with education, and that's why this video is centered around education. The rest, number 2, 3, and 4, those can be done with a one-on-one appointment so we can understand your needs. But education, everyone needs to know the basics of Medicare. So how about we start there? Educate, right? Here's an overview of where we're going with all of this. We're going to look at eligibility. I'm going to educate you on that. I'm going to educate you on original Medicare, supplement versus advantage, enrollment periods. So let's start with eligibility as we go into this. Who is eligible for Medicare? Well, Medicare is for individuals 65 and older. So most people get Medicare because they, what we call, age in. They age into 65 years old. But there are people who are under 65 with certain disabilities that get Medicare. I have clients that are in their 30s and 40s and 50s, and they have Medicare through their disabilities. Now, if you don't have Medicare and you're over the age of 65, here's a quick instruction on how you can enroll. You just go to the Social Security websites 3 months before you're eligible, or after you're 65, and you can register on ssa.gov. Original Medicare. Let's talk about this real quick. This is the original Medicare card that you may or may not have, or you may or may not be familiar with. So it's made up of 2 parts, and you can see I've circled the 2 main parts: hospital, which is your part A, and medical, which is your part B. In fact, some people have A and some people have B, and some people, actually most people, have both. But it is possible to have only one of these letters. So in order to be eligible for plan options later, we really want to make sure that you have both. Let's talk about both of these letters here. Let's start with Part A. Part A has a 0 monthly premium for most people. So up above here, you can see that 0 monthly premium. But here's what a lot of people don't know, is that you get it for $0 a month because you've earned your 40 quarters. I have seen people who have not earned their quarters. They have not earned their Part A. And so therefore, these people are actually paying $278 or $505 per month for Part A. Now, this is a very rare case. Most people get it for 0. But if you ever wondered, well, what is my money going to all this time that I've been paying into Medicare and Social Security? Well, it goes in to pay for your Part A. So you don't have a $505 a month premium. It's $0 a month. Now, Part A has a deductible, and that's for hospital, right? So a deductible is what you pay first before the insurance kicks in. And so the deductible for Part A for 2024 is $1,632, and that's per admission. That means if you're admitted to the hospital, you stay there for a few days, and let's say you go back home and a month later you go back into the hospital, well, you have to pay that $1,632 again because it is per admission. Now, this covers you for the first 60 days in the hospital, which is not bad until you're there for more than 60 days. Then it becomes a $408 copay per day, days 61 through 90. And then if you go beyond 90, it's $816 per day. And you only get 60 lifetime reserve days. So it's very important to understand all of this coverage. Part B is in boy. This is your medical coverage, and it has a monthly premium of $174.70. We call this the standard Part B premium. Now, this premium can go up or down based on your income. You can see the four asterisks there on the bottom of your screen. It actually shows that you can pay $0 a month instead of the $174.70, but that's only for people who qualify for like Medicaid, help from the state. And so the state, I live in Texas, Texas does help subsidize those premiums for people who are on Medicaid. And so their Part B becomes $0 a month. But standard is $174.70, and then it can also go up. So there's several levels that go above $174.70. In fact, the premiums can be as high as $594 per month. But those people are usually people who are making over $500,000 a year. And there's other brackets in between. So some people may have an income related adjustment if they're making, a few $100,000 a year. There is a deductible for Part B, and the deductible is per year. So you have a $240 annual deductible. Once you've met that deductible one time during the year, then it goes 80/20. Now, this is important for you to understand because you can already see that original Medicare isn't the most comprehensive insurance, right? By itself, there's gaps. There's deductibles, two of them. There's other costs, as in copays or co-insurance that you have to pay out of your pocket. So it's important to understand what's not covered in Medicare. That way you can make an informed choice as you move forward. So let's talk about Medicare Supplement versus Medicare Advantage. So now we're going to stick with the top portion here of Medicare on the top, but on the left, option 1, we're going to talk about Medicare Supplements or Medigap. In fact, a lot of people say, they've called me, I've had clients, Mr. Garcia, I don't want a Medicare Supplement, I want a Medigap. And I would tell them, that's the same thing. Tomato, tomato, right? Some people call me Randy, some people call me Randall, but I'm the same person. Same thing with Medicare Advantage. Okay, this is a different product, but it's also known as Part C. And so these names are interchangeable, and if Medicare wasn't confusing enough, there's so many different kinds of terminologies that you must be familiar with. So there's a few things to remember about Medicare Supplement. Medicare Supplement is secondary insurance. So imagine you're handing your red, white, and blue card to the doctor's office, right? So you're there at the doctor's office and you say, "Doctor, here's my Medicare card. It's my red, white, and blue. And then here's my second card, right? My secondary insurance card." That's what a Medicare Supplement is. Medicare remains primary, and the supplement comes in as secondary. It's the second card. And so if you have the setup like this, that's how it works. There's no network, there's no referrals. So the reason why there's no network, like no HMO, no PPO, is because Medicare's primary, meaning you can go anywhere that Medicare is accepted and there's no referrals. Some people need to go through health underwriting to get on a Medicare supplement, especially if you're, you know, 65 and a half and older. You're going to probably have to go through health underwriting. But if you're turning 65, you have something called OEP. We'll talk about that later. But basically, it allows you to get on a supplement without any questions asked. And then you also need to know with Medicare supplements that premiums are based on age and zip code. Okay. Next, Medicare Advantage. What is it? I like to say C stands for combines. Okay. It doesn't really stand for that, but I think it's real interesting. You can imagine Part C, right? C grabbing the A and grabbing the B and grabbing the D, the drug coverage, and combining them all together into one policy. So there's no primary and secondary like option one, it's just primary. Medicare Advantage combines everything into one policy and you use it for everything. Now, these are the network based plans, HMO and PPO. HMO is known for referrals, PPO is known for not needing referrals from the primary care doctor to the specialist. Either way, you have to continue to pay your Part B premium, which is the 174.70. These plans include extra benefits. They include financial protection, meaning they have an annual out-of-pocket maximum, and it's real important to understand that. Now let's compare costs. Now these are not quotes. Do not quote me on this. These are ballpark. But if you were going to try to do like a Medicare supplement, this is based on your age and zip code, so I'd have to run a quote. But you'd probably end up ballparking like a $120 a month Plan G, which is a very, very popular plan. And a Plan G covers all of the costs that Medicare doesn't cover, except for the Part B deductible. And then you have to get a Part D drug plan. The Medicare Advantage option has HMO and PPO options, but they have zero monthly premiums. So you still continue to pay the $174.70, but Medicare Advantage has no extra premium on most plans. Okay. I'd have to look at your zip code to make sure, but in where I live in Texas, there are basically plans in almost every county that start at a zero monthly premium. It's awesome. Now, HMOs have low copays and PPOs have higher copays. HMOs have more extras like more dental, more vision, more hearing, and PPOs usually have less extras. But these are general statements. It depends on your area. But really, the matter of fact is if you do an HMO, you're going to want to do an HMO for benefits. HMOs will maximize your benefits, include your Part D coverage, have more dental, more vision on average, and have lower copays. So a lot of people will say, I want an HMO because of benefits. And other people will say, well, I want an HMO because I want freedom. I don't want referrals, and I'd love to go without referrals. So it just depends on the type of person. Are you getting a plan for benefits, or are you getting a plan for freedom to go to the doctors that you want to see? Here's some enrollment periods. On Medicare Supplement, there's Medicare Supplement open enrollment period, which is your first 6 months after your Medicare effective date. And there's no questions asked on health underwriting, meaning you get to skip all the health questions and you get your policy as long as you do it within 6 months of getting your Medicare. Okay. There's guaranteed issue periods. So sometimes people are retiring, losing coverage from work, and there's guaranteed issue periods where you're guaranteed to get the policy. And then if neither one of the first two applies to you, then you have health underwriting. Here is a common misconception. Medicare supplements have no annual enrollment periods. So it's important for you to understand that. Also, that some plans are not available anymore. They've been phased out, just like Plan C and Plan F. You don't need to memorize all this. We'll help you straighten it all out, but you want to make sure you know what's what. On Medicare Advantage side, you have the initial enrollment period. So if you're turning 65, you have the 3 months before the month of your birthday, the month of your birthday, and 3 months after. It's a 7-month period where you can enroll in a Medicare Advantage plan. And then there's annual enrollment period. Medicare Advantage has annual enrollment periods October 15th through December 7th. And during this period, you can add, drop, or switch your Medicare coverage. Then there's OEP, Medicare Advantage Open Enrollment Period, which is January 1st through March 31st. So if you already have a Medicare Advantage plan, you can actually change to a different Medicare Advantage plan at this time. There's also special enrollment periods, so like special circumstances, right? If you retire and you lose coverage, or if you move out of the plan service area, or if you qualify for extra help or Medicaid through your state, or maybe you have a chronic condition, or maybe there's a 5-star plan in your area. These are 5 of many special enrollment periods that you can choose from. The next thing that we do at Medicare Pro is analyze your benefits, or analyze your situation. And so things that you're going to want to know is your doctors. So who's your primary care, who's your specialist, dentist, all of those things. We want to list all that out. Then we're going to look at your prescriptions, okay? And we want the name and the dosage and the quantity and how often you get them, because we want to make sure that your drugs are covered. The next thing that you want to do is we want to look at your subsidies. Is the government helping you? Are you considered low income? Do you get any help or Medicaid from the government? Here's some acronyms that you may or may not be familiar with. Some people get this based on income. And then what conditions do you have? Here's some common conditions that you might be that might qualify you for a special plan in your area. And then the next thing that we do is we help you select. So what are your plan options? So, okay, we're going to check all this. Doctors, prescriptions, what's my situation? What's my budget? Once we filter all that down, we can enroll you into the right plan. You can ask questions. We can enroll you. And here's what we'll need to get you started. But it all comes back to the knowledge. In fact, let me go back to the page that really talks about the difference in plan options. Look at all that information we covered, and really, which category are you in? Okay, are you going to look at a Medicare supplement? Are you going to look at a Medicare Advantage HMO or a PPO? Okay, which option do you think fits? Well, here at Medicare Pro, we represent all of these options: Medicare supplements, Medicare Advantage. Do we have a favorite? We don't have a favorite. Why don't we have a favorite? People always ask, well, what would you put your mother on? And I'd say, well, me and my mother would have to talk it out, because all of these plans are good in different ways. What are the goals, right? What is the budget? What are we trying to accomplish with these plan selections? And depending on the answer to those questions, we can actually filter through and narrow down our plan options until we land on the right one. So it's important for you, I would say, to choose a category. Now, if you need help looking up doctors, prescriptions, filtering through the plans, that's what we do at Medicare Pro. But it all starts with the education. We have to understand the basics, the education, the foundation. If you can understand that, choosing a plan will come so much easier, and you'll be able to understand what your plan options are, and you'll be able to sleep at night at the end of it. Well, that is it. If you'd like to work with Medicare Pro, what I want you to do is give us a call, a text, an email. Our phone number is 210-245-5519. You can reach our office line there. You can email us at info info@medicarepro.online. info@medicarepro.online. You can also fill out the contact form right below this video, and you can get all our information right there in the description to contact us. We can't wait to help you. We can't wait to serve you. I hope this information is helpful. And most of all, just call us if you need any help. We don't want you talking to some person in another state on a 1-800 telesales line trying to meet their sales quota. If you need honest advice, and if you have any questions or need more educations, then that's what we're here for. Hope you have a great rest of your day. Hope this was helpful. God bless you.